Hey everyone, it's Jessica with Montana Family Pharmacies, and today I'm here with Sarah, and I'm going to talk with her a little bit about cold and flu prevention and treatment and things you can do to really help build your immunity and your family's immunity, and then what you can do, of course, when we all get the inevitable cold during the season. Sarah is a pharmacist at Stillwater Family Pharmacy here in Columbus, where Montana Family Pharmacies is headquartered. So Sarah, what are the tips that you have for people when they are making sure that they want to try and avoid the common cold and flu and all those things?
Absolutely. The most common thing, or the thing that I try to recommend first to people, is just to practice good health practices, which include just the washing of your hands, doing that as often as possible, and using like hand sanitizers when they're not available. Also, protecting, everybody else around you, which just includes cover your mouth, nose, when coughing, sneezing, that type of thing. Lastly, you want to be extra careful, especially this time of the year, just to, when we go out and about, handling, doorknobs, things like that. Be careful not to touch your nose, eyes, mouth after doing that without washing hands.
Okay.
Another big thing that we can do, and that I recommend everybody does at this point, it's flu season, so it's time to get your flu shot.
What other things can you do to boost your immunity, like as far as kind of trying to build up those defenses, those natural defenses?
As far as boosting your immunity, the best things that they have right now out there, keeping up with like taking vitamin C, that's really one of the better things you can do for yourself, or zinc. There's been some studies on showing that that's been a benefit as well.
So these are some things that you would recommend at the first signs of.
Yeah, that's usually, and it may decrease the severity and the length of your cold.
Okay.
Cold is, a virus, so you just usually have to wait it out and just kind of roll with it. But this can kind of sometimes minimize how long you're dealing with it.
Okay.
This is emergency. A lot of people swear by it. Take it, as soon as they start, take it daily. And a lot of people feel like they don't even get the full-blown cold once they get started on it.
Okay.
Another thing that's been shown in studies is Zicam, or this is the zinc that I mentioned earlier.
Oh, this has zinc in it.
It does. Yep, that one
okay.
has the zinc, and that one can also be started. And usually people don't take zinc on a regular daily basis,
right.
But if they start feeling that first sign of like a little sniffle, sneeze, sore throat, cough, it's not going to cause you any harm to take it, and it might be a benefit.
Okay, great. I know people also who swear by emergency as well.
Yes.
Or, just like a standard sort of chewable vitamin C is great too. Do you recommend taking that all the time through the winter, or only when you really feel symptoms?
That is really up to the patient. But for me, I just, like when I have something coming on, I usually wait till I'm just starting to get those symptoms.
Okay.
A lot of times we're getting enough vitamin C in our diet to where it's not needed on a daily basis, but sometimes we just need that extra boost when we're our immune system is down.
Okay, that sounds good. So say you do have the cold, you've gotten a cold, what are some of the things that you recommend people do to help with their coughs, their congestions, and all those sort of common symptoms?
Absolutely. So there's all colds, as we all know, they can vary in symptoms, and you can have multiple symptoms, or you can have just one. So I try to focus on what is the most bothersome and treat that. In some instances, it's a good idea to use medications that cover quite a few different symptoms, but a lot of times I just try to focus on what's the most bothersome, because that's really going to be what helps you the most.
Okay.
For congestion, really the best thing I feel like is Sudafed. This is going to help with inflammation and also decreasing any sort of mucus production up in the sinuses. So anytime you have that head cold and you're just so congested, this is going to help out immensely.
Okay.
The one thing is, this is not recommended for anybody who has high blood pressure.
Okay.
Especially uncontrolled high blood pressure. So I have other options for that, but this is probably the go-to medication. Not intended to be used long-term, but at least to just kind of manage the symptoms and get the congestion under control and kind of open everything up.
Okay, and then if people aren't really sure if they should use this or not, then they should probably just talk to their pharmacist.
Absolutely.
Or their doctor. Yeah.
Yep,
okay.
Absolutely. For patients that do have high blood pressure, uncontrolled high blood pressure, there's definitely some options that are going to help. Usually what I recommend at that point is going to be an antihistamine.
Okay.
Which is kind of confusing for people because they're like,
Yeah.
I know I have a cold. I know it's not allergies because I've never, I know I have a cold, but this kind of thing targets a lot of the same symptoms you're going to have in a cold, and it's going to give you some relief.
Okay.
So I recommend this, for people who do have high blood pressure and are congested, and also people that have a lot of sneezing, watery eyes, have a really runny nose, that type of thing. This is a good option. I usually recommend the non-drowsy ones, which are Claritin or Zyrtec.
Okay.
Another good option are some of our steroid nasal sprays.
Okay.
And we have like some options are going to be Nasacort. That's going to, help with the inflammation and the mucus production to kind of bring that down as well, along with Flonase. So that's usually...
And are there generic alternatives available
Absolutely.
for all of these?
Absolutely.
Which is a lot of times, they're much more affordable for people, but these are the brand name.
Correct.
Yeah.
I brought the brand name just because a lot of people know it by the brand name.
Yeah.
But we are happy to help and recommend the generic alternative just because it's a little more cost effective.
Yeah, for sure. Okay. Great.
And then next is a good old cough. So there's a couple of things. So with a cough, cough drops, I really think that a lot of times I get the most relief out of a cough drop. Mm-hmm. There's also been a lot of studies that have been done, and honey is one of the better things that can help with both cough and sore throat. Mm-hmm. So hot tea, honey, like some of those things that you kind of grew up with are still some of the best things to help with that.
And for children, very small children, you can't use some of these things that have active ingredients for coughs. So
Correct.
There are like all
Correct.
natural
And
sort of honey-based cough syrups
absolutely.
out there.
And honey is a good option for children over the age of 1.
Okay.
Yeah. Younger than that, there's other things.
Allergies and stuff.
Absolutely. Yeah. And it's just it's usually recommended after they get the age of 1. It's fine to give them honey, but under that, it's a no-go or it's not recommended at that point.
Okay. All right.
And then cough drops, for the cough drops, I recommend cough drops with menthol for sore throat, but these are also going to help with the cough. The one medication I usually do recommend for people with a cough, its active ingredient is just specifically for the cough. I like Delsym. I like this one because it lasts 12 hours. So I feel like that gives you some good relief because a lot of times the worst thing about a cough is it keeps you up at night.
Yeah.
And so it's nice to get a little bit of relief because giving your body that chance to rest also gives us a chance to kind of heal up and move on from that.
Yeah.
So if I am going to use a cough syrup, I usually recommend that.
Okay, so for people who maybe don't want to necessarily take, quote unquote, a medicine, or they want to limit how much they take, but they still want to get some relief of their symptoms, what are some things that you recommend, or for small children, for babies, that you can't give them as the medicines?
Absolutely. Neti pots, that's become really popular over the last little bit. Okay. It's been really beneficial. So it's one of those things that goes up and it clears out the sinuses. So anything that you have in there, it'll kind of get out. It'll kind of get all that out. And I think it's a really good option to kind of clearing everything out without taking an actual medication.
Yeah. Okay. And then there are things for like nasal saline sprays and stuff, right? For babies that might help you get a little bit in there to help them get some relief, or the aspirators and things like that. For
Absolutely.
babies. Okay.
Yeah. That's kind of what we usually recommend, to just trying to use that bulb syringe still to clear them out and get them a little bit of moisture up in there, just to kind of help them help with breathing as well.
Okay.
The other thing you can help with babies, and this one isn't the baby version, but it's very similar, is going to be like kind of a Vicks vapor rub that you rub right on the chest. That's going to kind of help open up those airways and give them a little bit of relief, because nothing worse than a stuffy baby.
Yeah, for sure.
And not knowing exactly what you can do to help them, but that does seem to hopefully help them get over it a little bit quicker and open everything up.
Yeah, great. Okay. So tell me about if somebody has some, their main thing is that they've got really bad chest congestion, they're feeling tight, and what are some other symptoms of that? I don't really know how to describe that even, but.
Yeah, the tightness, or when you just go to cough, it sounds just deep in the lungs, and you have something going on along those lines. Thing that I recommend is Mucinex. I think it's one of the best things that you can take.
Okay.
This along with lots of water. It's an expectorant, so it basically thins the secretions that are in the chest. So with that, along with lots of water, basically you can cough it and get it out of you. Yeah. Just so you can get it out so that you can start feeling better. Yeah. Absolutely. Yeah. So there's Mucinex plain, and that I usually recommend if for people who don't have a severe cough with it. If you have a nuisance cough with it, there is Mucinex DM, which still has the expectorant that kind of loosens up that phlegm, but it also has a medication that kind of suppresses the urge to cough. So you can have a little bit of relief from that, but when you do cough, you'll probably be getting stuff up, which sounds gross, but that's what you want.
Yeah, right. For sure.
We've gone over quite a bit of things today, but just some general recommendations. But really, we like to help the patient. So everybody's really patient specific. So everybody's on different medications. So we're happy, and all pharmacists are happy with any patient coming in and talking to us, telling us what you take. So we can kind of customize, tell us what your symptoms are, so that we can kind of customize and help you, so that we can help you limit what you're dealing with, and you can get over your cold symptoms and be on your way.
Okay, great. All right, well, thanks to Sarah for chatting with me about how to help build up your immunity, prevent the common cold and flu as much as possible, and then when you come down with it, things you can do to help ease your symptoms and make yourself feel better. And you can get these types of recommendations as well as, like she mentioned, any pharmacist is happy to talk with you about your specific situation, what you're experiencing, the other medications you may be taking, and what would be the best route for, the best treatment for your certain situation. And you can do that at any of your local pharmacies, which you can find at montanafamilypharmacies.com.